The spread of Ebola is of grave concern, even in areas of the country not in immediate danger, like here in the Treasure Valley. But one local woman has launched a nonprofit that aims to stop threats like Ebola. Jake Melder joins us in the studio to share a story that is positively Idaho.
Someone has kidney stones or if someone's gallbladder is inflamed.
Running the emergency room at St. Alphonsus in Eagle keeps Dr. Heather Hammerstead pretty busy. But 30-hour shifts and an unpredictable schedule wasn't enough for her. Through a travel abroad program during her Harvard education, Hammerstead visited a hospital in Uganda and saw something disturbing.
There was nobody triaging, there was no emergency department, there were no physicians who knew how to provide emergency care, and I realized that it was something easy that I could give them, is the expertise on how to provide emergency care.
As Heather looked into how she could accomplish this, another scary fact came her way.
Where I work in Uganda, there's 4 doctors at the hospital who care for a catchment area of 300,000 people.
So Dr. Hammerstead started Global Emergency Care Collaborative, a medical training program like none other. The goal is to train nurses that can provide medical care in an emergency.
So we take the procedures and the thought process and the diagnostics from the physician and teach it to the nurses so they become sort of what we call mid-level providers.
The unique 2-year program trains nurses for 1 year. Then trained nurses teach the next year's batch of students. Only 5 years into the pilot program, they're seeing great results.
We've significantly decreased the mortality or morbidity or the sickness and death from malaria.
The emergency care training also helps stop communicable diseases, such as Ebola, in its tracks.
They recognize people very quickly about what seems like it might be dangerous or not. They isolate them and they treat them appropriately.
This kind of response is not present in West Africa, where Ebola has spread more so than any other time. Hammerstead says the training her group provides is the key to improving general health in the developing world.
You put all money into something like HIV, you spend millions of dollars treating one person for 20 years, and then they get hit by a car or they get pneumonia and nobody knows how to take care of them.
Hammerstead's program has been so successful, other countries like Kenya and Cambodia have asked her to implement her program in their borders. Dr. Hammerstead says it only takes $300 for a year of emergency care training. And with nearly all donations going to those in need, $50 goes a long way. We'll have a link to more information about the program on our website, IdahoOnYourSide.com.